Hi guys, welcome and welcome back to the Edutainment channel. Welcome back to my channel. My name is Malebo Mukwena, the first enrolled nursing auxiliary YouTuber in South Africa. Welcome to Vlogtober Day 11. In today's video, we are talking about auxiliary nursing requirement. We are talking about scope of practice and duties. And probably we'll talk a little bit about the nursing schools because Dr. Matthew, when I catch you, a quick disclaimer. I am a registered enrolled nursing auxiliary. I'm registered with South African Nursing Council. I pay my annual practicing certificate every year. I almost said every month. Every year. Now, I am not practicing at this moment because why? I'm unemployed. Okay. This are scraps that I got when I was working in hospital. The knowledge that I'm sharing is the knowledge that I got when I was working in hospitals, when I was working everywhere that I was working. That is the knowledge that I'm sharing with you guys. That's a disclaimer, right? I don't want to hear, hey, you didn't pass maths. Hey, why? Hey, Lona le savage. I can remove Dr. Matthew at this point. I can imagine what he's going through, but it serves him well. I mean, how do you scam people of thinking that you are a doctor? How, what guys? At least even in nurse. Okay, let me not put down nurses. But Dr. Matthew, allegedly Dr. Matthew, Abut Matthew, whatever you are, you caused us stress as a nation. So yeah, without wasting any further time, today we are talking about requirement of being an auxiliary nurse. What is an auxiliary nurse? An auxiliary nurse is someone who works under direct or indirect supervision of registered nurse. That is a scope. When we talk about the scope, we talk about the rules that governs you as a worker. Even if you are in retail or in other areas, other environments in your workspace, there are rules that governs you. There are supervisors before you. There are superior before your supervisors. Same as nursing. When we talk about scope, we talk about the guidelines that you work under. So my guideline as an auxiliary nurse is working under direct or indirect supervision of registered nurse. When I say direct supervision is when I'm with a registered nurse and she's telling me what to do. When I say indirect supervision, it's when a nurse tells me that, can you please go and assist this patient with whatever, and she's not there. You understand? We do not give out medication. We do not carry out plans that are from doctors. Normally, they make a care plan. When they make a care plan, they include medication, they include what is necessary for the patient to recover from whatever is affecting the patient. So you deal with the physical, mostly you deal with the physical side of the care plan. When it concerns medication, it's either your registered nurse or your enrolled nurse will do it. In most cases, in hospitals, you'll find auxiliary nurses running drips. Like already the medication is there. You're just gonna run the machine. You're not gonna do anything concerning medication. You're just gonna change the what's this? The what do they call this? Why do I forget? The what's this? The saline drip, that bag that they hang there. You're just gonna change that because basically it's water pushing medication inside your body. Or they will ask you to change an IV line. When we change the IV line, we don't change where they put the drip. We only change where the pipe is running. They will ask you to make the patient, no, even that is not a matter of being asked. That's part of your job. You'll make beds. You'll make sure that the environment that the patient is in is clean. You'll call cleaners to clean maybe the bathroom, to wipe stains on the floor. And when there's water shortage, you have to call the kitchen and make sure there's water. You go inside the patient's room to open curtain, open windows, greet the patient, find out what the patient is, how they slept, or how they doing for that specific period that you are with the patient. You are literally an advocate of a patient, but then you help nurses as well to what's this? Yo, English here, Taba guys. English is on break. You help them with running the care plan, if that makes sense. Yeah. So the duties, everything that I mentioned are duties. Let me re-mention them. You will make bed. That's one of your duties. The first thing that you do when you clock into work, right, is find out is getting a report. They will tell you how the patients are doing. It's very important, guys, to take reports. I know most people will say, "Hey, I'm late, Mara." Because 7 is sharp. Usually reports are taken around 6:45 before shift starts. It's either it's a 12 hour shift, so it's from 7 to 7. So you have to take a report, guys. That's crucial as an auxiliary nurse, okay? Because you'll be dealing with patient. You need to know what the patient is suffering from. You need to know how to deal with the patient or how to better treat the patient. Understand? So yeah, you'll take report. After taking report, you will gather your equipment. Maybe if a patient needs to be bathed, sometimes we did this because of there'll be a lot of patients that needed to be bathed, and then you cannot wait people around 1 o'clock or 2 o'clock just for them to have a bath. So you need to divide your patient. Maybe you'll have five that you bath before you start shift, like from between 7 and 8, 9 sometimes, and then some of them will bath in the morning around 4 o'clock in the morning. That's why they wake you up at 4 o'clock before, because we don't want you to bath at 6 o'clock while our shift ends at 7 o'clock. Some of y'all do not bath and say, "Oh, the nurse didn't wake me up." And you know how unpleasant it is to be in a hospital taking medication and not bath, because most medication make urine smell. So it's likely that your body odor will smell. So guys, you need to take a bath, and please bring your flops when you go to hospital so that you don't have to walk barefoot on the hospital floors, because yeah, there's duties of auxiliary nurses, right? And the scope I told you, we work under direct or indirect supervision of registered nurses. And nursing school, guys, I always stress this. If you are embarking on a nursing journey, please visit South African Nursing Council website. There are colleges there, universities, and whatever it is. I forgot the third one. But mm, but they are all accredited to offer the new curriculum. Some of them still offer old curriculum. Okay? Don't go around Pretoria looking for a school and then come back to say, "I've been scammed." Before you even go to Pretoria or Joburg or KwaZulu Natal, anyway, please check the South African Nursing Council. Check within your area if there's a nursing school, and go to the nursing website. Check that school if it's accredited to offer the nursing curriculum. Simple as that. Okay. Um, when I was still a student, my college was under a lot of pressure because people said it was not accredited. But we passed and got certificates and whatever. The following year, those people who came the following year were struggling. They struggled to get their certificate. They even went to, there was this show on SABC to speak out. They even went to speak out, oh, to say the school is expensive, it's racist, it's this, hey, it was a lot. So they didn't accredit to offer the new curriculum. I don't know if it's still a nursing school or whatever, but I know that it's not accredited. Okay? So please, I'm stressing this once again, check South African Nursing Council website for accredited colleges or universities near you. Okay? Don't leave KwaZulu Natal to come and go to a nursing school in Gauteng only to find Hore. It's a fly by night. Look for schools that are within your region and check them on the South African Nursing Council, right? So, um, Yeah, guys, when you go into a clinic or hospital, you need to learn how to differentiate people that are in hospital. Some of them wear epaulets. Epaulets are uh, badges that usually are on the shoulders. As auxiliary nurse, we have a pin, sort of a brooch, a round brooch. We have that. That's what we wear. But apparently, they said they were going to make epaulets for auxiliary nurses. I don't know what that. I don't know if it happened or didn't happen. Since I'm no longer working, I don't follow nursing news. I don't know why. I know I need to keep updated. I need this, I like that, but I don't do it. I don't do it, and I'm sorry. I'll make sure I do better next time. So I think we are done. We covered everything. We talked about the scope of practice, which is the guidelines that governs auxiliary nurses. We talked about duties of auxiliary nurses. I told you what we do as auxiliary nurses. I talked about nursing schools. I told you you need to visit the South African Nursing Council in order for you to know which school you want to go in. Let's talk about the requirements. What do you need in order for you to become an auxiliary nurse? Number one, guys, you need maths. Talked about this yesterday. You need to align yourself with the career that you want. If you want to embark in nursing, you need to align with the requirements of nursing. Maths, either pure maths or maths lead, doesn't matter. You need biology or life science, doesn't matter. You need English. You need I think those three, maths, English, and life science, that's what you need, right? If you didn't do any of this subject, if you are still in high school and have the opportunity to change your subject, please try to do maths, English, and life science. If you already finished school and you don't have any of the subject, you need to look for pre-courses that will help you or give you an advantage to go into nursing school. Most colleges or universities offer pre-courses for you to enter into nursing, but it's mostly a 1 year course and it's extra money. So yeah, I think I've covered mostly everything. Comment down below with any question at all concerning nursing, and I'll try to cover that topic. We're still repurposing videos that have did well within a year or two. The one that I did before this was 2 years ago. This one was a year ago. So thank you once again for supporting me. I will see you on my next video.